Hi, my name's Holly Duggan. I'm going to be performing inserting a foley on my patient and then removing the foley. To start, I'm going to wash my hands. Hand washing takes up a lot of minutes in these videos, so I'm just going to use my hand sanitizer. But if I were actually going and do this on a patient, I would actually wash my hands. So now I'm going to go into my patient's room. Hi, Danielle. My name's Holly. I'm going to be a nurse today. I'm going to help put in your Foley catheter. Can I have your name and date of birth? All right, perfect. Thank you. Do you have any allergies? A latex allergy? Any allergies to iodine? No? Okay. Are you in pain today? Perfect. All right. I'm just going to set myself up here. This is my partner, Jintara. She's just going to help hold up your legs just in case. Sometimes putting in a Foley, your legs will kind of just go back down onto the bed and we don't want to contaminate. So here you go. If you have any questions at all during this procedure, please feel free to ask. For my female patient, I'm going to try to get her legs up and her knees bent as high as possible, but seeing where, yeah, these knees don't really bend on this one right here. So I'm just going to have G hold open this leg since this one's pretty far and I can work with that. I would do good perineal care with warm soapy water before I went in and actually started opening up my kit. Are you okay? All right, gonna get my tape ready. I'm just gonna initial it, write the date, and the time that this Foley will be getting put in, and this will be what I secure to my patient's leg after I am done inserting the Foley. I'm going to check my Foley kit, make sure if my patient had a latex allergy. This was a latex-free kit. I'm checking to make sure that there were no breaks. Since this was still my practice kit, we're going to pretend like this has never been opened before. My kit is also not expired. I have an extra set of sterile gloves just in case I needed them. I would have an extra Foley in case I accidentally put the Foley into my patient's vagina. I would leave it in and start with a new one. So now I'm going to open up my sterile field. Where'd my tape go? Okay. Gonna open up my kit with the flap furthest away from me, being careful of my 1-inch border. After doing peri-care on my patient, I would have washed my hands before touching my kit. Very carefully. Now I'm just gonna position it the way that I like it and what's more comfortable for me. If any part of this package was damaged, I would just get a whole new kit. I'm gonna start with my sterile gloves. I like to start with my dominant hand, that way I have better control over my non-dominant hand glove. Now that I am sterile, I can start touching my kit. I'm just gonna have G pull up the Johnny. Thank you. Opening up this sterile field that I'm going to place right under my patient. Just gonna leave it. If I had a male patient, I would position the fenestrated drape around the penis, but for this I am not going to use it. Going to just move this since I'm sterile and I can touch that. Just gonna get myself all situated, open up my swab sticks, take the lubricant and insert the, there we go, insert the foley. I'm gonna take my saline, I'm gonna insert it right here. That way my kit is all ready for me to go. I'm going to take this whole thing over to the patient's bedside with me. I'm just going to position it right there. I'm going to use my non-dominant hand to spread open the labia and hold my swab sticks, and I'm going to clean with my dominant hand. Clean on the outside, drop. Clean on this side, drop. If I was doing it on a male patient, I would do circular motions, one sweep around using all my swab sticks, starting at the meatus. Danielle, I'm gonna start inserting your foley now. Just let me know if you have any discomfort, okay? All right. Just inserting the foley until I get urine flow. And once I see urine, I'm gonna push it in 2 to 3 more inches. I would blow up my balloon with this 10 mLs of sterile water. And then once my balloon's inflated, I would pull down for resistance. I am going to take off my sterile gloves. I am going to take my tape the foley to the inside of my patient's leg, making sure there's a little bit of room so I'm not like tugging while it's in there. And I'm going to take the foley bag and I'm going to hang it onto the bed rail, the railing of the bed, not the side rail. And now I'm going to put some clean gloves on to clean up my area. For my patient. Now to remove the foley, I would check doctor's order, make sure that I had an order to remove it. I would perform hand hygiene before entering into my patient's room. If I needed a sterile sample, I would take a syringe and insert it into the sterile port. I'd wipe it with an alcohol wipe first, and I would put it in this little specimen container and send it over to the lab. Now I'm gonna demonstrate doing the foley removal. So I would come into my patient's room, knock on the door. Can I have 2 identifiers, name and date of birth? Perfect, it's Danielle Robert. She was born 7/4/92. I would provide privacy for my patient. I'm gonna start with putting on my just regular gloves. All right, Danielle, we're gonna remove this foley today, okay? All right, I'm gonna unhook the foley catheter. I have my drape over here. I'll put it under my patient just in case a little urine comes out. I don't want it to be all over the bed. I'll insert my syringe and pull back. I would look in the order to see how many milliliters actually took to inflate the syringe, and seeing where it's 10, I would draw up to 10. Perfect. And now I'm just gonna untape the Foley from my patient, and I'm gonna very slowly but gently just pull back on the Foley catheter, making sure I don't let it go all over the place, because you don't want anybody to get sprayed with urine. Perfect. At this time would be a perfect opportunity to do a little pericare, make sure she's nice and clean down there. I would be monitoring her strictly for the next 24 to 72 hours for intake and output, making sure that my patient is having urine return. I would throw this into the trash. I would document my findings. If I found anything abnormal, I would report it to the primary care physician. I would take off my gloves and wash my hands.